Hi, I'm Larry Warren. I'm a director at Clear Passage Physical Therapy. Several people have asked me to explain a bit more about therapy before in vitro fertilization and how it seems to actually does improve success rates with in vitro fertilization quite a bit, actually. In women over 40, the rates were something like 3 to 5 times the norm. Actually, we'll show you a graph comparing our work showed in green before IVF versus the gray, which is the national standard from the U.S. Centers for Disease Control and SART, the Society for Assisted Reproductive Techniques. Basically, there are three things that we think we're doing in treating women before IVF and improving those pregnancy rates. One is working with the cervix and the uterus. Two is working with the ovaries. And three is working with what's called the PHO, the pituitary hypothalamus ovarian axis. That is the communication loop that occurs between a woman's ovaries and her pituitary gland, the master gland of female reproduction, about 1.5 inches in here, about 3.5 centimeters in the center of your brain. I'm going to talk about all three of those and specifically what we're doing and what we believe is affecting these changes, because it's just physiological, it's just mechanical. There's no, spiritual is great, but there's no woo-woo about this. What happened was we had treated way back in the beginning, 1990, we treated about 6 or 8 infertile women, several with blocked tubes, some without. Most of them became pregnant after we treated them, despite an infertility diagnosis. When this woman came in and she said, Larry, can you help me? I'm already scheduled for an IVF transfer. Can you help before that transfer? And I said, well, I don't know. We've not really done that before. I'm glad to treat you if you'd like. So we reviewed her medical history so we could treat her, and we did. And when I started treating internally, I got on her cervix and I said, She said, what's that? I said, well, it feels like your cervix is pulled way to one side and it's kind of almost like it's curled up. And she said, oh, yeah, I can tell you about that. I said, really? She said, yeah. Can you do anything about that? And I said, well, let's see. I think so. So she said, because I've had 2 or 3 other IVF attempts, none of them I have gotten pregnant. And the physician, when he is ready to put the catheter in through my cervix into my uterus with a fertilized egg, he's always sweating because he's worried that the embryo is going to die in the room temperature because it's so hard to get that catheter into my cervix. Now, not all women have a cervix that's curved like that, but stenosis, which is a stiffness or a tightness, is quite common. Some women may notice this because they have pain with deep penetration, where their partner is running into that. Some people may not know that they have stenosis. But at any rate, she said, so the doctor, he finally gets that straw in, that catheter in, and puts the fertilized egg inside my uterus or two, and he pulls it out. It looks all bent and like a piece of spaghetti, she said. Anyway, it was 3 of them, and none of them did I ever become successful, and did I ever become pregnant. And I said, well, let's see what we can do. And I treated her a few times, and for a few hours before her IVF. She came back. I said, how did your IVF go? She said, well, number 1, I'm pregnant. And I said, that's great. I said, how was the transfer? She said, that was really interesting because the doctor, I could tell he was coming up to me and he was really worried already, because he remembered who I was. He remembered the problems he had. He went to put the catheter in and it just slipped right in. He actually grabbed my chart really quick. I think he was checking to make sure he was inserting this into the correct woman. And of course he was. And it went in easily. And afterwards, like I said, I became pregnant. And I asked him about the transfer. And he said, it's really one of the easiest transfers I've ever done. So, and she did become pregnant with that transfer. So, what's happening here, and we can see this in some films, we can see this in some images, the cervix becomes tight, little cross links, the building blocks of adhesions. If you have had a vaginal infection, a bladder infection, a yeast infection, even an undiagnosed infection, these little cross links tend to form in the vagina. They're like little strands of a nylon rope. They're very strong, and they can form between the muscle cells within the cervix. And when that happens, it can tighten that cervix, creating a more difficult entry for sperm to get in, or for this catheter. And the other thing it can do is it tightens, is it pulls on the uterus, pulls on the area above the larger organ that should be relaxed and comfortable and just a beautiful and hospitable surface for implantation, and can cause spasm in the uterus, so that when implantation takes place, instead of being in a nice relaxed environment or nice relaxed organ, it's in an organ that is adhered and in some spasm and probably a bit of inflammation. If that cervix happens to be pulled toward the back right, every step forward you take with your right foot can pull on that cervix and pull up into your uterus and continue the cycle. So the first thing we think we're doing with these women is we're checking their cervix and getting things as mobile and as supple as we can. Of course, we're treating the entire uterus to decrease any cross-linking there as well. The second thing is that we're treating ovaries. Ovaries can be affected certainly by hormonal conditions, but they can be greatly affected by surgeries, cysts, traumas, an injury, a fall, gymnastics, of landing on your hip, where your ovary is right on the inside of your acetabulum, where your leg goes into your pelvis. So having a hip injury or a fall can really create some adhesions, that these same little cross links that form at the ovaries. It can decrease the easy movement and function of your ovary. And that ovary should be able to function beautifully. The third thing that we've found is that some of the women that we treat, they will have an asymmetry at their cranial bones. Now, cranial bones don't move. You have 22 major bones that comprise your head, besides your teeth. Certainly they don't move like an arm or a leg would move, but kind of like continental shelves on the surface of the earth, there is a slight amount of mobility, or should be, between and among all the cranial bones. Your pituitary gland, which is, as I alluded to before, right here, sits in a little cella turcica, a little cave inside the sphenoid bone, a bone that goes from temple to temple. When these larger structures down below, your neck, your back, start pulling on your cranium and on the cranial bones, it can actually torsion that sphenoid some, and we think put pressure on that pituitary gland. At least we believe that's true, because when we test FSH levels before and after we treat that entire structure up there, we see significant improvements. We know also that there's a direct relationship between your tailbone, where your dura starts. Your dura is the covering of the spinal cord. It comes all the way up your inside of your vertebrae to the base of your skull and then into your head, and it totally surrounds your pituitary gland. When your tailbone gets pushed forward or pulled forward by a fall onto your bottom, or a surgery or an infection, it can pull the entire structure, pull down on the base of your skull, and we believe can impose on that pituitary gland. Physicians know and recognize that there is a communication loop that occurs between the ovaries in your pelvis and the pituitary and hypothalamus up in your head. Every month your ovary is calling on the pituitary gland, give me some FSH, some follicle stimulating hormone, to help these eggs grow. As you age reproductively, your ovary is saying, give me more of that stuff, give me more of that stuff. So physicians know that this communication loop occurs, they don't actually know exactly why it occurs or how it occurs. Through the studies that we've published and the success rates that we've seen treating mechanically, just using our hands, no drugs and no surgery, we've seen significant improvements when a woman goes through IVF, significant improvements in FSH levels. So we surmise that a lot of that communication loop is mechanical, just from these crosslinks that form from the bumps and bruises that you get through life that cause little crosslinks to form, whether they're here at the base of your skull pulling on your head, or whether they're at your pelvis pulling on your ovaries or your uterus, your tubes, or anywhere really along that line. So that's what we believe is happening with that PHO axis, it's called. When we treat the whole structure from cervix and uterus to ovaries and then all the way up into the cranium and the pituitary gland and relieve pressure there, the whole structure seems to work much better, and indeed does work much better. We have strong statistical numbers for improving pregnancy rates for women that go through IVF after we treat them. So that's what we do for women who come to us before an IVF transfer. If you have further questions, certainly give us a call, check out our website. We'll look and see if you seem appropriate. If you are appropriate for our therapy, we'll tell you. If you're not, we'll let you know that. We want nothing but success for you if you're an appropriate candidate. Thank you.